Hi, everyone. Thank you so much for joining us today for this webinar. We are anxious to spend some time with you today answering some of the questions that you've sent to us and some of the questions that we've come up with through our research. The title of our webinar, as you can see, is Debunking the Myths on the Drug Supply Chain Security Act. We have with us today our Chief Compliance Officer, Denise Garcia, who is going to run through some of the most common myths that we've heard. Thanks. I'm going to turn it over to Denise.
Hi, everyone. I hope you're having a good day. We are in Virginia, and we're getting our first taste of winter this season. Had a little surprise ice storm last night, which kind of keeping us on our toes before the blizzard next week. So I hope you all are safe and ready to talk about track and trace. So what we're going to do today is we're going to answer some of the most frequently asked questions that we get regarding the new law and how it applies to all of you. So that's what we're going to be covering today. So I'm Denise Garcia. I'm an attorney by background, a healthcare attorney with over 20 years experience. I have expertise in creating practical solutions to complex regulatory requirements. I've worked for different startups, for hospitals, many different types of healthcare businesses. And for the last couple of years, I've been focusing on compliance. And so that's what I bring to the table. And I have made sure that our product, our software, meets the requirements of the law, and that it will continue to meet the requirements as the law changes over the next 10 years as it's rolled out. So before I continue, I just want to check quickly to make sure everyone can hear. Do we have audio? Is everyone hearing what I'm saying? If you're not, if you could type so we can get a note and we can just make sure that you all can hear us.
Or if a couple of you could just unmute your mics real fast and give us a quick shout out, that would be helpful too.
We can hear you fine.
I can hear you fine.
One more time.
We can hear you.
Folks can hear us, right?
Yes.
Terrific. Is that better? I just turned my volume up. Does that sound a little bit better?
Yes.
Mm-hmm. Okay. All right. So we're gonna start now then. Oops. Here we go. All right. So what we're gonna do today? First, I'm gonna give you the skinny on the law. What it is you need to know. A quick overview of what this law is that you need to deal with. Second, I'm going to answer some of the most frequently asked questions that we see when we talk to different dispensers and pharmacists about this new law. And the third, I'm just going to go over briefly the requirements, what you have to do, and kind of give you some suggestions on the best way to move forward. So one of the questions we frequently hear is, this new law, FDA, they're not going to come after us little guys. So, they're going to go after Pfizer or, one of the big manufacturers or Cardinal. We don't have to worry about this. So the first thing I want to tell you about that is this is new for FDA to be creating a law that really affects your part of the market, the dispensers. Previously, they did focus most of their efforts on the manufacturers, on recalls, on those types of things. But this law is very broad, and it does apply to everyone, including all of you. It is going to be enforced, most likely the two scenarios that you will see is the state auditors who come by to audit your store for licensing purposes. They may be auditing on these track and trace requirements as well. And they may fine you if they find something wrong. And the second scenario that is likely is if FDA has to do some sort of investigation due to potential counterfeit products. If they contact you and they're asking you for information and they look into what information you have, if you're not in compliance with the law, they may fine you as well. So those are the two scenarios that are most likely to happen. So what is this law I'm talking about? This law is part of two laws, actually, that were passed in November of 2013. It's called the Drug Quality and Security Act. And the purpose of the law is to create a nationwide database to track and trace all drugs that go through our supply chains to make sure that we can track the ownership. It's kind of similar to a car title. When you buy a car, you know every owner of that car from the time it was manufactured to the time you bought it. Same thing with this. When you buy a drug, you'll know the ownership based on this data that we're all required to have now. You'll know the ownership of that drug every time someone purchased it along the supply chain. This law is pretty ambitious. In 10 years, it'll require tracking down to the product level, down to the unit, to each bottle, through 2D barcodes. But for the first couple of years, it doesn't do that. They're waiting for the technology to be in place so that the distributors and the manufacturers can provide that information. Another question we sometimes get is, this deadline has been extended. It was originally July 1 for dispensers. They extended it to November 1. And then literally, I think the day before, they extended it again to March 1st of this year. So you may be thinking, okay, well, they've extended it before, so, what are the chances that, they'll extend it again? I don't think that they're going to extend it again. I've been asking other people who are important stakeholders, and no one is getting a sense that they are going to. And the other thing I need to point out is the majority of this law is already in effect. The only part that has been extended is one small part that has to do with you holding transaction data and having that on hand before you accept a product that you purchased. So as far as you should think about the fact that this law is already in effect for all of you. So another question is, what is the cost of this compliance for this software, and what does that cost compare to the risk of potentially being in violation? Well, I know you all know of, perhaps you or some of your colleagues may have had the state regulatory agency come by their store and find small violations here and there. And you know what those fines add up to. So our software solution is nominal compared to some of the fines that can come out of those types of inspections. This will be an avenue for them to inspect as well. So it makes a lot of sense for you to have all this in place, because in the long run it will save you money, and it will save you a lot of headaches because you'll have everything quickly at your fingertips so that you can handle anything that comes up. Another question, isn't this just another way for the government to make money? Why do we need these regulations? The reason for this law is to make sure that our drug supply chain is safe throughout the country. And I know many of you think that you've never seen a counterfeit drug come across your shelves. And I hope that is the case, but I'm here to tell you that the counterfeit drug market is alive and well. The market is a $200 billion industry. If you, for instance, just look at Pfizer. Pfizer in 2008 was able to identify 20 of their products that were subject to being counterfeit. And that has tripled since 2008. In 2014, there were 60 products of Pfizer's that they had found were counterfeit. So all of that to say that it happens. It happened earlier this year. FDA sent notices to a bunch of pharmacists who had purchased from a shady distributor. So I know that it feels like it's never going to happen to you, but the chances are there. Another one we often hear is that this new law is for wholesalers. Doesn't apply to a small pharmacist like like my store. Unfortunately, that's not the case. This law, the definition of who is covered under this law is very broad. A dispenser is really anyone who distributes drugs, particular classes of drugs, to patients. When they buy drugs and they have them on hand and they sell them to patients or give them to patients. So this would include pharmacies and hospitals, assisted living facilities, dermatologists who are selling rebranded products in their office. They fall under this law as well. Dentists potentially fall under this law as well. Compounding pharmacies, however, are covered under the first part of this law. There is another section of it that deals strictly with compounding pharmacies and sets new requirements for their facilities. So for the most part, compounding pharmacies are not covered under this law for compounded items. For the ones that are regular drugs, they would be covered under the law. Another question, I'm not clear what the requirements of the law are. I'm good at keeping records. I think I'm probably compliant. Well, there are 3 different requirements under this law. The first is that you need to verify that all of the suppliers that you use to purchase your drugs, that all of them are properly licensed in the states where they are. The second is that the one that's been delayed until March 1st of this year, that is you have to have in hand before you accept a product the transaction data that includes all of the ownership history of the product. You have to have that in hand before you can accept a product. You have to keep that data and be able to retrieve it within 48 hours if requested by the government. So that's the second part of it. And the third part is you have to have a process in place to be able to assess whether any product might be suspect or counterfeit. You have to be able to conduct an investigation, have a quarantine area where you can put the products in while you're conducting the investigation. And then you have to know how to ask for verification from your trading partners in the event you find something that might be suspect, and how to notify FDA in the event you find something that is suspect. So the first part, where you have to verify your suppliers, it's not as simple as knowing that they're a big company, they might have taken care of this. You actually have to make sure that each distribution center, each address that sends you product, that they are licensed and authorized to do business in your state. So for instance, let's say Cardinal has more than one distribution center that you use. Each distribution center, their address would have their own license, and you need to make sure under your state files that, that their license is effective. Also, manufacturers and distributors have to report to FDA annually all of their licenses. So they are maintaining a database. It's not quite accurate yet, but I think down the road it will be. And that's another source where you can look for information about your trading partners. So 2 items to point out about verification process. The first is if you are about to use a new wholesaler, I would recommend that you check your state database and make sure that they're licensed to do business in your state. Worst comes to worst, you could ask them to send you a copy of their license. And the second thing is before you sell product to someone else, your license has to be up to date as well. Because your trading partners need to verify that you are in fact an authorized trading partner. Another question. I've heard some people say something about 3 T's. I'm not sure what transaction data is. So under the law, they refer to the ownership information and the basic product information as transaction data. And that is 3 different parts to that. The first is called transaction information, and that's the basic information about a product. The name, the API number, the lot number, the manufacturer, the dosage, and the strength. The second part is the transaction history, which is the series of owners of this drug from the time it was manufactured. Anytime a drug is sold, all the information about the owner and the seller and the purchaser are added to the transaction history. And the third part is called a transaction statement, and that is basically a certification that the seller makes every time they sell a product. And that's basically like saying that this product is authorized, I'm an authorized trading partner, and the product is not counterfeit and complies with the law. So these three items are sometimes referred to as the 3 T's. So the transaction data part, the 3 T's, the enforcement of this part has been delayed until March 1st. And what is required under this part is that you may not accept ownership of a product unless the previous owner provides you with the product transaction data. You must have it on hand before you accept a product. You also, if you're going to resell a product to someone else, you have to send transaction data, including your information as a new seller, to the purchaser so they have your information as well. This information must be stored for 6 years, and at any time, FDA or state authorities could request certain information from you, and you would have 48 hours in which to fulfill that request and give them that information. So however you store the information, you have to be able to retrieve it pretty quickly. If you use more than one wholesaler, let's say you use a lot of secondaries, this might be difficult to do because you may buy a product from different wholesalers at different times. And if you have to research something that happened 3-4 years ago, it may be a little difficult for you to get your hands on the paperwork and to really drill down and figure out what exactly you need to give to FDA. Our product at InfiniTrak handles all of that for you, makes it very easy. So sometimes we hear, what's a suspect product? That is not something I ever came across. They think it comes from larger pharmacies and in large cities where there's high fraud. They don't think they have to worry about this part of the law. Well, I have to tell you that, as I said earlier, quarantine products are alive and well, and in fact, in April of this year, FDA sent letters to over 300 different dispensers regarding 29 different drugs that had been distributed from a company, a foreign company that was representing itself as a Canadian drug company. And instead, what they were selling were cheap drugs from overseas that in some cases may not even have been authentic. So to give you another example, it wasn't this particular situation, but another one similar, FDA tested a sample of Avastin, the cancer drug, which is an injectable, and what was in the vial was in fact just water and mold. So, think about what effect that would have on cancer patients, your patients. You all are really the last line of defense for patient safety. And even though it feels like this is something you may not worry about, all of your staff need to be trained on what to look for in the event you see something unusual to make sure to follow up on it, because unfortunately these situations do happen. As I mentioned earlier, our product handles all different parts of the law. We have a product wizard within our software that allows you to answer questions to make sure that anything unusual that comes up, you can determine whether it's something that might be considered suspect and you need to do an investigation, and you can document your business practices. We know that you all don't have time to get into the weeds of this law, and that in the rare event that something like this were to happen, your staff is not going to have this knowledge at their fingertips. That's why we've built it right into the product and to make it really easy for you all to be able to figure out what you need to do in these circumstances where you may have to do an investigation. We also have the ability to print quarantine labels when you have a product that is potentially suspect. Under the law, you have to separate it from your inventory and put it in quarantine, and we have the ability to assist you with that, as well as the ability to upload different documents that you can attach to any investigation you might have. It might be photos or interviews or whatever you might have. And we will keep this information for an additional 6 years from the time you conducted the investigation, which is what is required under the law. So one question is everything I sell covered by this new law? The law has a variety of exemptions. I had mentioned earlier compounding. So compounding products are for the most part not covered by the law. The only exception would be if a compounded product is made using finished pharmaceutical products as one of the ingredients. The finished product would have to be traced, and so therefore that particular compound would have to be traced. But other than that, they are not covered. And then here's a list of some of the other categories of products that are not covered under the law. If you want more detail, I recommend actually going to the text of the law because it has more description of, like for instance, the combination kits. Another practice that we see is very common is that sometimes pharmacies borrow or lend to a neighbor pharmacy, and they want to know what happens now that this law is there. How do they need to handle this? So, as I mentioned earlier, anytime you sell a product, you have to send the transaction data from that change of ownership along with the product. And so that is what you will need to do now if you do sell something to a neighboring pharmacy. Our product has a function that easily allows you to do that. You take the product out of your inventory, you identify it, and the transaction history will be created. The 3T will be ready to be sent either electronically through our system if they happen to be members of InfiniTrak, or it could be saved as a PDF document. You can print it out or email it to them. So one area that people ask about is policies and procedures. Do they really need to have a paper document in their office with the policies and procedures? Now, I am biased because I'm an attorney, and I have to say after my 20 years of healthcare practice, the best way to prevent liability is to make sure that your business practices are well documented. And the best way to show what your business practices are is to have a policy and to make sure that your staff is trained annually. Even if you mess up, if you make a mistake, if you can show that that is your normal business practice, it will certainly help in any investigation that might happen to involve you. So I strongly recommend that you have a policy in place for all your staff so that they know what to do in the event any of these issues arise under the law. They understand the law, they understand what they need to do under it. And I recommend that you have an annual training of your staff to go over it to make sure they know what to look for in the event there's a potentially counterfeit drug in front of them. And they know where to go to get the resources in the event they have to do something further. So here's a picture of one of our customers, Travis Hale. He is in business in a rural area of Virginia, in Remington, Virginia. And he is I think he feels that InfiniTrak is going to provide him with a lot of comfort for compliance with this very complicated law. We also have a template policy that once you sign up with InfiniTrak that we will provide to you, and that is a generic policy that you can customize to your own practice, and that is a good starting point for you to have a policy in place to cover this law. So the other piece that is important to know is if you use more than one wholesaler, and I know that many of you do, there are certain occasions where you have to get a particular drug if there's a shortage or something from a different source. And our product will aggregate all the data in one place, and you will be able to electronically search for any items, whether it's something that's just come in or something that is in the past that you had accepted and may no longer be on your shelf. You can search for that information flexibly in a variety of ways and print out reports. So, for instance, if FDA were to find a product and discovered that your pharmacy actually received a shipment from a distributor who is selling counterfeit products, and they ask you to look up information from a particular date range for a particular product, you could easily go into our system, type in that information, pull up the report, save it as a PDF, and send it immediately to FDA. Under the law, you have 48 hours to respond to any requests from state or federal regulators with regard to the transaction history of a product. So that's the basis of my presentation. I know that I went over a lot very quickly, so I want to open up to see if anyone has any questions. If anyone wants to unmute and ask questions, I'm happy to answer them.
Hi, this is Amar.
Hi, Amar.
How are you? You had mentioned about the store-to-store transfers or pharmacy-to-pharmacy transfers. And from what I had initially heard was if there is any specific provided that which prescription or which patient that transfer pertain to, then we do not need to maintain the DSCSA the records for that. Is that correct?
Right. So, Amar, what you're referring to is there are a couple of exceptions in the law for certain types of transactions that don't need to provide that transaction information, the 3T. And you're right. If it's for a specific patient that you're filling, you would not need to transfer the 3T information. If you are transmitting between related pharmacies, you guys are affiliates, co-ownership, you have common ownership and control, then you do not need to transfer that information every time you change from one to another. But if you happen to be selling to someone who's not related to you, let's say it's a hospital, it's not for a specific patient, they just want to make sure they have it in stock for the weekend, then that would be a situation where you would have to provide the 3T information to them.
Got it. Okay. So basically, to summarize, whenever there is a transfer, we need to have a situation where we know exactly who it's going to. In that case, it would be considered as an exception.
Correct.
Okay. The ultimate user needs must be known at that time, basically.
One second, I'm going to raise the volume. I'm having a little trouble hearing you, Amar. So
what I was saying was so basically the ultimate user's information needs to be there for it to fall into the exception category.
That's correct.
Okay, got it.
There has to be a prescription that you're filling.
Got it.
It's a bit tricky. It's kind of vague. They haven't mentioned, actually, it's a HIPAA issue, right? You want to you don't want to provide the PHI along with it. We haven't gotten clear guidance from FDA on that, but I would say your best practice would be to document that it's for a specific patient need, and if you could identify some unique identifier for that patient, perhaps their hospital number instead of their name, and that would be, I would consider, best practice for that.
Okay. I didn't get the part you mentioned it could be a potential HIPAA issue. How would that be an issue with HIPAA? I mean, if we are providing that to the federal officials or the state officials, they are under law. We are obliged to give them that data, right?
That's correct. Absolutely. It just raises, yeah, that you're absolutely right on that.
Okay. That's all my question was. Thank you.
Thank you, Amar. Appreciate it. Does anyone else have any questions? So I know some of you might have had a couple of technical difficulties as far as not being able to see the picture or not being able to hear as well. For all of you, we will be putting a link up to this webinar.
Hey, Sally.
To you.
We will send that to everyone. Are there any other questions? Luke, do you have a question?
I do. Just to be clear, InfiniTrak, y'all aren't storing any HIPAA-related information. Is that correct?
Correct. We're not storing HIPAA-related information, unless you put it in there. But we're not. Generally not. You can keep notes, you can keep investigations, but there's no need to, because this is really just about the product before it gets to your inventory management system. So it really shouldn't have patient information in there.
Gotcha. Does a store have to sign a BAA before they get involved with InfiniTrak?
No.
On the off chance that PHI may be put in the system?
No. I mean, I have it written in the contract that the subscription contract is basically serves as a data management agreement. Under the law, they talk about if you have a third party who's going to handle your data, you should have a contract in place for that. So the actual subscription agreement serves as that, and we specify in there that HIPAA is not included. It's not what we intend.
Okay. Thank you.
You're welcome. I should point out to all of you just one point about that. I know some of you, your wholesalers, your primary wholesalers have told some of you that you don't need the software. And I want to make sure that you all are all protected. They're not really in the business of trying to look out for your needs. Under the law, it says very specifically, if a third party is going to handle your data, that you should have a written agreement in place. And I've heard of very few wholesalers who are willing to sign a contract that specifies that they're going to hold your data for 6 years, that you have access to it in a searchable format, and really provide protections to you about how they're going to hold your data. Now, I'd like to hear about it if any of you do have such a contract, but a lot of them are not doing that. I would say in that case that you're not fully protected. And so that's the reason why it makes sense for you to control your data and to have a solution that's completely flexible that you have control of. So
essentially, I can actually answer that as far as one of the wholesalers I'm aware of. They do have an agreement in place, but the agreement is only to hold and house the data and nothing else.
That's right. So if I were your attorney, I would not be happy about that. I would be trying to negotiate. Not that you have negotiating power on this, but yeah, I wouldn't feel warm and fuzzy about that at all. So when other questions come in, John Howells has asked, when do the saleable returns requirements start for the pharmacies? It starts, I believe, in, I think it's 2017. For now, it's not a requirement at all. It's later on when they start having more information on the 2D barcode, they're going to be requiring you to send that information back. So for now, any saleable returns or non-saleable returns, you do not have to worry about providing the transaction data back to the distributor that you got it from. Okay, another question, please explain how InfiniTrak captures the information. So there's actually two methods that we use to get information into the system. The primary method is electronic. So all of your wholesalers have a language where they keep a database where they keep all of your information electronically. It's called EDI. And we've built our software to integrate with that. So what happens is once you sign up, we tell you give your wholesaler authorization to let us have your information. We swap security certificates and they connect to our system and your information starts flowing directly into your account on the cloud. You have your own separate account on the cloud. And it's kind of like turning on your water utility. As soon as you open your account, the water starts flowing. Same thing with this information. As soon as you're hooked up to your wholesaler, the electronic data starts flowing into your account. The second way that you can get information into the system is you can manually enter it. You can either enter all the information if you're working with a particular small specialty distributor who doesn't use an electronic system, or you can scan your paper documents and add it to the system as well.
These are great questions. I hope if anyone else has questions, you can either unmute yourself and ask, or you can write in, and it'll pop up on our screen.
Hi, this is Amar again.
I have a question on the screen from John. When will you migrate from EDI to EPCIS system? So for you all who do not know what EPCIS is, it's the new system that the wholesalers and the manufacturers are leaning towards as the overall solution for this down the road. And they are working on trying to figure out the best structure for that. That's part of the law has to do with creating some grant money to figure out the best solutions for the whole industry. They are taking the lead on this. It is certainly something that we are aware of and we would like to be involved in. And it's something that, if possible, we certainly would like to have the ability to migrate to EPCIS. But at this point, it's too premature. We just don't know what they're doing yet, but it's something we're tracking.
I think I heard another question out there. Was someone else trying to ask a question?
Yeah, hi, this is Amar.
Hi, Amar.
My question was once the account is set up with the InfiniTrak, does your system go back and capture previous data also, or that's something that would have to enter manually?
Yeah. So the question was, once you sign up for InfiniTrak, does our system go backwards retroactively and capture prior data, historical data? The answer is no. As far as the electronic piece, the EDI, once you're hooked up, it flows in from your distributor. I don't know of any distributors who are investing the resources and the staffing to be able to answer specific requests for blocks of data from particular time periods. If they are willing to do that, our system can certainly accept it. I just don't see that happening yet. The second thing you could do is you could manually enter that information into the system. You could just simply upload your paper documents and index them and get your information in that way.
Got it.
If we don't have any other questions, we got one for Jen. Will you address the difference between distributors and dispensers, since some pharmacies provide products to others?
So, Jen, that's actually a really difficult question because each state is slightly different on how they handle that. Dispensers are defined under the federal law pretty widely, but the licensure at the state law is also affects this. So, for instance, some states have a 5% rule where if you distribute less than 5% of your inventory to other pharmacies, they do not consider you to be a distributor. Other states do not have that. This is a gray area. I know that there is a contingent of stakeholders who have petitioned FDA for more clarity on the situation. I know there's some websites where you can go and sell an open bottle of a product to another pharmacy like Match RX, and they are asking for more guidance on this, and they anticipate the FDA will be giving more guidance, probably in the exceptions guidelines that they were supposed to have out in November. They were late. They haven't provided that yet, and so we are waiting to get more information on that.
All right, I don't see any other questions, and I don't see anyone else unmuting themselves. So I want to thank all of you for your time today. I hope this was helpful information. We did not prepare this or plan to present this as a sales presentation, and it is not that. But I would be remiss if I didn't tell you at this opportunity that we do have a very special pricing in place just for the months of January and February prior to the March 1 enforcement deadline. Some of you are members of state associations that we have agreements with, or buying groups that we have agreements with. I can tell you that right now, for a very limited time, our pricing is set at $89 a month, and there's even a little bit of a more deeper discount if you sign up for a year-long subscription. So my name, email, phone number, everything is there. You can go on to our website at www.infinitrak.us to get more information. We look forward to hearing from all of you. We will send this presentation out to you so you'll have a record of it. And we'll look forward to talking to each of you soon. Thank you very much for your time and attention.
Thank you so much.